You walk into a clinic. Crowds are waiting on the dirty seats and on the floor. You drag your suitcase of medical records and wait for hours while more people stream in. You finally get to see the doctor and get to spend maybe a minute, maybe less with him. You're sent to another location to have your blood work run. You can't be sure that the results are accurate, so you go to 3 more labs just to compare. You continue to brave traffic to pick up your prescription at a pharmacy. Maybe the drugs are real, or maybe they're not. If you've ever been a Bangladeshi patient, this may sound like your last visit, or maybe every visit. As a Bangladeshi American, I knew the healthcare system of my family's native country was limited, but my eyes were open to the challenges facing Bangladesh's 170 million people when, a few years ago, my mother was hospitalized for a basic operation. She suffered some complications, and unfortunately, our doctor didn't seem to care what she or our family were going through. I distinctly remember chasing him up 2 flights of stairs to get answers to our basic questions. Thankfully, my mother recovered, but the experience haunted me. The next thing I knew, I was packing up my life and going on a global listening tour to learn more about the Bangladeshi healthcare system that had failed my family. Bangladesh is actually doing better on social development indicators than any other country in South Asia. By investing in primary care, the public system has made dramatic strides in terms of life expectancy, maternal and newborn health. But beyond the most basic primary care, even the masses are accessing the private system. The private system, in contrast, unfortunately, undervalues primary care and delivers episodic care that's highly transactional and driven by backwards incentives, encouraging doctors toward hospitalizations and over-ordering of tests and drugs, treating patients like dollar signs. This is not a system that patients can trust with their lives. In fact, thousands of Bangladeshis travel every single day abroad to access better care. I met a maid who earns $3 a day, and when her daughter fell ill, she borrowed money not to access the best doctors in Bangladesh, but to travel to India, where she believed she would be able to get better care for her daughter. Across the board, Bangladeshi patients told me their doctors don't spend any time with them, they don't answer their questions, they don't even look at them in the eye. A light bulb went off for me, and I launched Praava Health. You walk into the lobby. You're greeted by a Praava guide. You scan your membership card, which gives you access to services at an affordable price point. You meet your family doctor. She spends 15 minutes with you. She listens to you and answers your questions. She's not in a hurry because her success is measured by her patient's health, not volume. Maybe you're pregnant and need an ultrasound. You're escorted to the 5th floor for that. If you need blood work done, you go to level 2. From there, your sample is sent directly to level 7, where it's analyzed in one of our 6 labs. You don't have to wonder if you can trust the results because our labs are established according to international standards. On your way out, you pick up your prescription in our model pharmacy, where you can trust that the drugs are manufactured, stored, and dispensed properly. Praava is changing the way that healthcare is delivered in Bangladesh and filling an important gap between underfunded public facilities and overpriced private facilities. On top of this, we're rethinking the way that technology can transform a doctor's visit. We host Bangladesh's first patient portal, where patients can access their medical records and prescriptions and book appointments. And if a patient brings a bag of their medical records from life before Praava, we scan and store it for her. Praava's brick-and-click model promotes a continuity of care so that no one falls through the cracks. As Bangladesh grows and remains one of the fastest growing economies in the world, the private sector cannot afford to continue business as usual. We need a healthcare system that's accountable and transparent, driven by values. Across the globe, we all need healthcare systems that treat patients with dignity. As a female CEO in a sector where female leadership is so lacking, I take my role very seriously. Our voices are needed when the burden of caregiving falls so disproportionately on us. Every day when I walk in, I think about chasing my mother's doctor up those stairs and about that maid who stretched herself so thin to get better health care for her daughter. This is my guiding light, to restore trust in a healthcare system that's broken and to reimagine the way that healthcare is delivered.